Hi, I'm Chris Winterode, a State Health Insurance Assistance Program Coordinator for the state of New Mexico, and I'm here to tell you about some important information about what's new for Medicare in 2022. Your Medicare coverage and costs can change each year, so it's important to understand and review your benefits. Here's an overview of changes and opportunities in 2022. It's really important to understand your Medicare costs. Part A costs, Medicare Part A covers inpatient hospital services, skilled nursing facility services, home health care, and hospice. Most people do not owe a premium for Part A. If neither you nor your spouse have 10 years of Social Security work credits, however, you may owe a monthly premium of either $274 or $499 per month in 2022, depending on the number of years worked. If you're admitted to the hospital, you will owe a deductible of $1,556. If you have multiple hospitalizations, you may owe the deductible more than once. If you meet your deductible, your first 60 days in the hospital cost zero per day. If you're hospitalized for more than 60 days, you may owe an out-of-pocket cost each day for your continued hospital stay. If you're admitted to a skilled nursing facility, you will owe no copay for the first 20 days. You will then owe $194.50 a day for days 21 through 100 in 2022, and the full cost of care after day 100. Call your state health insurance assistance program or SHIP at 1-800-432-2080 for more details about Part A costs, or if you need assistance with the hospital or skilled nursing facility costs. Medicare Part B covers outpatient costs such as doctor visits and outpatient procedures. In 2022, the standard Part B premium is $170.10 for people with a yearly income equal to or below $91,000 for a single person, or $182,000 for a married couple. If your income is higher than that, you may pay a higher premium. Keep in mind that if you have a Medicare Advantage plan, you may also pay an additional monthly premium for being enrolled in that plan. If you have Original Medicare, which is Part A, Part B, and a Part D prescription drug plan, you will owe an annual Part B deductible of $233 in 2022. You will continue to owe a 20% coinsurance for most services covered by Part B. If you need help with your Part B premium and/or copays, you may qualify for a Medicaid program called a Medicare Savings Program. Call SHIP at 1-800-432-2080 to see if you're eligible for this benefit. Medicare Part D covers outpatient prescription drugs. In 2022, the national average premium for a Part D prescription drug plan is $33.37 per month. Your particular costs vary based on your plan and your prescription drug needs. If your Part D plan has an annual deductible, it can be no higher than $480 in 2022. If you and your plan spend $4,430 for covered drugs for the year, in most plans you will reach what's called the donut hole or the coverage gap. In the donut hole in 2022, you will owe 25% of the cost of your drugs. If you spend $7,050 on covered drugs in 2022, you will enter what's called catastrophic coverage. Then you will owe 5% of the cost of each drug, or $3.95 for generics and $9.85 for brand name drugs, whichever is greater in 2022. If you have a Medicare Advantage plan, the amount you owe varies by plan. Contact your plan for more information about your Medicare costs. If your income is limited, you may qualify for help. Contact your SHIP at 1-800-432-2080 to see if you're eligible. Know your opportunities to change coverage in 2022. You may be able to change your coverage in 2022 outside of the open enrollment period, depending on your circumstances. If you have a Medicare Advantage plan, you have one opportunity from January 1st through March 31st to change your plan or switch back to original Medicare with or without a prescription drug plan. You may also qualify to return to your Medigap plan if you had one. If you think a government employee made a mistake while assisting you, contact 1-800-MEDICARE and explain your situation. You may be approved to change your coverage. If you have extra help, an assistance program that helps pay for Part D prescription drug costs, or a Medicare savings program, you may make one change per quarter for the first 3 quarters of the year. Another important thing to understand is that the public health emergency may affect your coverage in 2022. Due to the COVID-19 public health emergency, or PHE, certain flexibilities have been in place and some restrictions lifted in 2020 and 2021. Examples of these flexibilities include expanded coverage of telehealth services and coverage for 90-day supplies of prescription drugs when requested. As of December 17th, 2021, the PHE declaration will be in place through January 16th, 2022. The PHE declaration has been extended multiple times previously, but there's no indication that it will again be extended. If the PHE expires, many of the current flexibilities and lifted restrictions may expire as well. Congress and the Centers for Medicare and Medicaid Services are working to extend some of these flexibilities regardless of the PHE status. So details of how these Medicare coverage rules will change are still being discussed. To stay up to date on this evolving conversation, pay attention to the news. You can contact your local SHIP at 800-432-2080. And watch for information from the Centers for Medicare and Medicaid Services, or CMS. Marketing violations could affect your 2022 coverage. Medicare Advantage plans and standalone Part D plans are administered, marketed, and sold by private companies. Plan representatives, agents, and brokers must follow federal guidelines when marketing to you. These guidelines protect you from manipulative and deceptive sales and enrollment practices that can lead to marketing violations by a plan. Here are some red flags. If you signed up for a plan after being told by an agent or company that it contains certain services or prescriptions were covered, but after enrolling you discovered that they were not covered by that plan, a company represented itself as coming from or sent by Medicare, Social Security, or Medicaid. You received an unsolicited phone call or text from a plan with which you have no prior relationship. You've not asked to contact you, or of which you are disenrolled from. A plan agent returned uninvited to your residence after missing an earlier appointment. An agent discussed other insurance products, such as life insurances or annuities, during a meeting that was scheduled only to discuss a Part D or Medicare Advantage product. If you had any of these circumstances, you may be eligible to change your coverage based on marketing violations. Please call us at 800-432-2080 to report this activity. So to recap, you should review and understand your Medicare health care costs. If you have original Medicare, review your Medicare and U 2022 handbook or request one by calling 1-800-MEDICARE. You can also find the handbook online at www.medicare.gov. If you have a Medicare Advantage plan, see the annual notice of change or call your plan to learn more about your costs and coverage. If you're unhappy with your coverage for 2022, find out if you can make changes during the Medicare Advantage open enrollment period from January 1st to March 31st, or during a special enrollment period. Contact your SHIP at 800-432-2080 for help. Pay attention to the news, information from your SHIP program and CMS for any updates on how the public health emergency may affect Medicare coverage rules in 2022. Contact your senior Medicare patrol at 1-800-432-2080 if you enrolled in a plan because of misleading information or were enrolled in a plan without your consent. Your health care is important every year and certainly important now in 2022. If you have questions about any of your coverage or about what you may be eligible for, your New Mexico SHIP program is here to help, and you can reach us at 1-800-432-2080.